Welcome back, everybody. We're excited today. This episode, we're going to be talking about the fact that your heart doesn't just pump blood. I think that's the major misconception is your heart's a pump. And although that's true, it doesn't just pump blood, it actually listens to your brain. Most people think their heart's just a pump, that it squeezes and it pushes blood, and that's really just the end of the story for your heart because its job is just to take blood in and push it out. The reality is that's not actually how it works. Your heart doesn't just pump blood, it listens to your brain.
Right. So if somebody's saying my heart rate's off, right, or my blood pressure's high, or something along those lines, right, then we immediately, obviously, have been taught that the first thing that we jump to is the heart. Something's wrong with it.
Yeah,
it's defective.
The pump's not working. Right. So we have a pool, and we have a pump on top of our pool.
Right.
It's pretty simple. It's a pump, and you put it in the water, and it takes electricity to turn it on, and then it just pumps water. Now it's a little more complicated.
It's seemingly simple, but somehow it doesn't work for me regularly.
It does have a ball in it, and when the ball floats, it turns the pump on. So it's a switch, and then it shuts the pump off. But so now we're adding to the complication, right?
Right.
So there are many things that can go wrong. You can have the ball might be frozen, or it might be stuck. Some debris might have gotten in and the ball's not moving, so the switch isn't moving. The pump could actually have sucked up leaves or something that's blocking the pump so it doesn't work. The hose could be frozen. We actually had the hose was too long. It was too long. So the pump was trying to push, but it couldn't push enough water to get out the end of the hose. Yep. So the hose is too long, so that could be it. But the other one, and the one that frequently people don't think about, because you're like, the pump's not working. Why isn't the pump working? Well, maybe it's the power to the pump. Right. Maybe it's the plug. Maybe it's the breaker. Right.
Which has been the issue
on multiple times.
Multiple times.
So this is exactly the thing we want to talk about, is that every beat of your heart is being regulated through your nervous system. And these nerves are constantly communicating with the tissue of your heart. Your heart isn't just an organ. It's layers of tissue, and embedded in those layers of tissue are a vast network of neurons. You actually have nodes, bundles of nerves, like tissue has nerves in it, but then the heart has these, they're literally called bundles, your AV node and your SA node. And these bundles of nerves are nuclei where there's just crazy neurologic activity happening, but it's coming from the brain to the heart and then getting re-signaled to go out. So what this tells me is all of the nervous system signals are telling it to speed up, to slow down, contract harder, relax a little bit. Your heart's actually responsive to these signals, and it's adaptive. So the question is your heart listening?
Is it listening to the signals that it's going out? And listen, here's the thing. So this is where HRV comes in.
Yeah, absolutely.
Right. So that's heart rate variability. And I feel like HRV, it's really been on the scene the past few years in a big way. I don't know if there's a PR person for HRV or what, or if it was just generally an understanding.
Aura.
Yeah.
Whoop. Yeah. They're the PR people for Whoop, Aura, Apple Watches.
Yeah.
They're measuring HRV, and they might call it might not be, you guys might not know it as HRV, you might know it as recovery rate or whatever.
Yeah, and that's the big thing about HRV, right? There is some significance to HRV, and that is essentially how adaptable are you? And here's the thing about adaptability. So this is a great principle that you taught me, is that your body's ability to adapt is huge. It's a huge factor in your health. It was one of the things when cold plunges kind of came on the scene, whoever's sponsoring cold plunges, those companies, right? When they start talking about what's cool that a cold plunge does for you, what is it? Is it just jumping into a battle of, a big thing of ice water or cold water, and lots of different layers and benefits for it. But when I first started cold plunging, I was like, I'm going to jump in the sauna after this, right? And you're like, no, bruh. Yeah. No. That's not what you do, because it's really your body's ability to adapt in that environment and then bring yourself back up to normal, right? And to regulate it. And so that was a big piece of that. But so HRV, when we're talking about how adaptable your nervous system, that is significant, right? It's not just how fast your heart beats, but it's also how well you in general respond to change.
Yeah, I would say your survival values in life are directly correlative to your body's adaptability. And adaptability is strongly tied in. I'm going off script here for a second. Adaptability is hardwired into your nervous system, that your nervous system is literally your body's adaptive system. Okay. What I mean by that is seasons, right? Hot, cold, this, that. Like go down to Florida in the winter when it's 72 degrees and everybody's wearing parkas and ski jackets, right? And then go out to Colorado in March when it's a bluebird day and it's 46 and sunny and everybody's wearing t-shirts and skiing down the slopes.
When we were in Orlando recently and they had a cold snap and it was like 58 degrees, 59, almost
everybody's
60.
wearing parkas.
And let me tell you, 58 degrees in Orlando, Florida does not feel the same as 58 degrees in Cincinnati, Ohio when it's end of January, right? And so we were down there and we are still in like a short sleeve shirt and pants or a long sleeve shirt and pants. And there's other people that are in full, like
my dad was quoted as saying on that trip, I don't golf in 50 degree weather in Michigan, but today it was 38 when we teed off and I had a blast and it felt great. Yeah. So it's different and it's adaptability. Right. So when we talk about adaptability, we're not just talking about hot and cold. We're talking about stress. We're talking about temperature. We're talking about busyness. We're talking about rest versus stress. We're talking like all these different things. And your nervous system, one of its jobs, it's not just controlling your organs, it's coordinating their functions to respond to things. And when I say stress, everybody thinks about it in a negative way, but everything's a stress. When you eat, there's energy required. Anytime there's energy required, it's technically a stress. So it's your body's ability to take energy, to spend energy, and to adapt all of this for what? For the benefit of the structure in which it resides. So here's what's fascinating. Like you talk about cold plunges and why do we say don't use the sauna afterwards? You're supposed to get exposed to heat. You're supposed to get exposed to cold. That's great. But we live at 72 degrees, right. 68 to 72 all the time. So people have gone, hey, we're gonna get in saunas and sweat like crazy to stimulate our immune systems. And then we're gonna get in cold and we're gonna do that. We're gonna stimulate our fat cells and we're going to lose fat and we're going to do these extreme things. Well, the reason we have to do that is because we have gotten so moderate in our lives that we're like 68 degrees, pretty much all year long and we don't suffer or have to adapt. Right. So now we have forced adaptability. What was called biohacking used to be called living. Go out and chop some wood in the winter and go out and sweat your what off in the summer. And it was called living and now it's called adaptability. The same way that organic food 100 years ago was called food. And so here's what's fascinating is that was the sub-subject. Yeah. But let's go into this. Your healthy heart doesn't beat like a metronome. And most people think it does because they've been told it's, 68 to 72 beats per minute and a blood pressure of 120 over 80. That's bull crap. It's a lie from the devil. And by devil, I mean big pharma, specifically coming out of Harvard. And that lie came from a bunch of people in class sitting together going, excuse me, professor, teaching pharma medicine on behalf of the Rockefellers and Carnegie through the Flexner Report, giving grants to Harvard College for what would be today billions of dollars. What should somebody's blood pressure be? And they're like, oh, that's interesting. What do the drugs try to regulate it at? Oh, 120 over 80. And so what they did was they took everybody's blood pressure in the room. I don't know how many students were in the room. The record is not really there. Was it 20? Was it 40? Was it 60? We don't know. But the average was 120 over 80. Now, were half of them malnourished? Were half of them obese? Did they exercise? Did not exercise? Were they we don't know anything about them, but the average was 120 over 80. So today we still use 120 over 80, and that's based on that exact incident. Now, if you take it over a large scale population, it's still 120/80. You can go, okay, that's roughly what it should be. Given what? That you're resting, that you're not under stress, that a bear's not in the room, that you're not racing the kids to school, that you're not like just waking up and your blood pressure might be lower or whatever that is. But here's what's fascinating is that your heart rate and your blood pressure, this is not about even numbers, it's the variability. And that's what this heart rate variability means, is that your body's ability to shift between stress and recovery. And in the nervous system, we name this as sympathetic and parasympathetic. And so I think that's what we really want to talk about. And you know, the whole idea about when variability drops.
Yeah,
you
when
and I were talking about
variability
this.
drops, then that's a big issue, right? That's when you're not going back and forth between those two systems. You're stuck over in this stress mode.
Your inability to adapt.
Yep, your inability to adapt, right? You just want your body to be able to adapt. And what happens when you get stuck and you're not adapting? Poor sleep, fatigue, anxiety, high blood pressure. There's lots of different things that can happen when you get stuck sort of in that rhythm and you're not adapting.
Yeah, I've said this to you for the last 3 days. I told you I'm waking up at like 1:30 in the morning and I'm like ready to go. And I'm like, but it's only 1:30 in the morning.
Right.
I got 3 hours to go.
Was it because it was the week of my birthday and you were just so excited
Yeah.
for it to come?
There's maybe another
and
story there.
like,
But the reality is I would wake up at 1:30 in the morning and I'm ready to go. And then I'm like, oh, now I got to go back to sleep. And it would be a little challenging. And then I would wake up at like if you wake up at 1:30 feeling fine, you would think you wake up at 5:30 feeling fine. But I wake up at 1:30 feeling fine, and then I lay there for 30 minutes, get back to sleep for a couple more hours, and then I wake up at 5, and I feel like horrible. And I'm like, what is going on? Mm-hmm. And it's this idea. And so my first question was, what's happening right now in my life? Because this idea of sympathetic dominance. Mm-hmm. Nervous system, 2 splits, voluntary, involuntary. Voluntary is what you control. Move your arm, right? Flap it like a wing. Run, do whatever. Voluntary. Involuntary, heart beating, lungs breathing, whatever. You have influence over it, but not intentional influence typically. So that's the involuntary. Involuntary, 2 splits. Sympathetic, fight or flight. Bear jumps in the room. You're going to either fight something or run from it. And then there's parasympathetic, rest, digest, and healing. So if I'm waking up and I'm like, boom, ready to go at 1:30. What do you think is going on? There's some sympathetic dominance that's happening. I'm in this fight or flight. I'm ready to go. And then my body wasn't designed to wake up at 1:30 in the morning. So I try to get back to bed. I'm not running from danger. There's not a bear in the room. I don't have to handle a crisis per se, but maybe my body is dealing with that. But the idea is that we're not meant to live there. And I realized like this is an abnormal thing for me, especially. So our heart, is your heart constantly getting the message to stay on, to stay ready, to stay tight, to fight, to constrict,
right.
And that's where blood pressure goes up, rhythm, heart rate goes up. Your body's being told like, hey, we gotta be ready. So like, we gotta be ready to go at any given moment, and it's boom, it's ready to go. But does it ever get that relaxation? If not, then what is going on? Is it chemical, emotional, or physical? And those are the big 3 things we need to look at.
Right. And so it's not that the organ itself, it's not that the heart itself said, I forgot how to do my job.
Yeah.
I don't know how to pump.
Yeah.
I don't know what's going on here. It's that the signaling going to the heart.
Yeah.
The issue is the signal. The issue is the communication that's happening to it, so that's the thing that's getting disturbed right now. And that's what's keeping us in a position where something's stuck. Yeah,
your heart didn't forget to be a heart. It didn't think, oh, crap, I think I'm a kidney. For a minute. Like, the intelligence is still there, but, like, it's responding. And what is it responding to? And so, like, in that situation, just being vulnerable, my thought was, like, am I stressed about something I don't know I'm stressed about?
Right, yeah.
Is there something happening? Like, have I made changes recently in nutrition or whatever? And we have, like, alcohol,
yep.
made some changes. So I'm like, okay, like, is there something my body's doing to respond to some of the changes we're making. You know what I mean?
Yeah.
And those are real questions. So the instructions you're talking about, they travel from your brain through your nervous system, down your spinal cord, out through your nerves. And this is where now structure really matters, because along that pathway, if it was just a clear highway, signals would be going, but that highway travels through your spinal column. And your spinal column moves, and your spinal column protects your nervous system, but at the same time, it's the framework and movement for your spine. So if something moves out of alignment and it puts pressure on the signals, and those signals get distorted, the rhythm changes and the messages actually get distorted.
Right. So you've heard somebody before say, oh, my hands always get really cold, or my circulation isn't great. And really what we're talking about there is, it's not just a blood issue. But
people think it is because they can see it, right? Like,
right.
No, they get white. They don't turn red.
I have blood here,
like,
and I don't have blood here.
My toes are cold. My fingers are cold.
Yeah.
It's circulation. My doctor told me it's circulation.
Yeah, right. And the thing is that it's communication. That's the issue.
Yeah.
The issue there is the communication.
Because what are we talking about? What's controlling the constriction or dilation of their blood vessels? Because blood going to your fingers on a vascular level is constriction or dilation.
Right.
So if cold created constriction, which it does, but if that was exclusively the problem, you'd be like, your whole body would be doing it.
Right.
But your extremities, and like, why is it happening at those extremities first? And is it normal? Is it a normal response to stress? And the best way you can tell if it's normal is if yours is pretty severe and your friend is next to you and you're in the same temperature.
Yeah.
And they're not responding the way that you are, then you know it's not exclusively cold.
Yeah. Yes.
It's how you're adapting, going back to that word adaptation, that blood vessels will constrict, but it's based on the nervous system's input. So your heart rate can shift based on that input, inflammation, tissue repair shift based on that input. Your body's not random, it's being coordinated, but what we're talking about is if there is a poor response to that stress.
Right. So there's physical stress, there's emotional stress, and then there's chemical stress, right? So we got three different types of things that could potentially be causing an issue with output. And what's really interesting to me is that, I don't know, I think that I just always, physical stress was the one that was like the only one that ever really showed up on my radar. You know, like when I think about stress, it was really like, oh, did I do anything stressful lately? As in, oh, did I, do a workout that was heavier or different in my body than what I typically would do?
All right. So physical stress, I mean, easily you could think like car accident, football, you know what I mean? Hits. I don't know. Deadlifting inappropriately.
Sure.
Right?
Yeah.
But emotional stress, and I would argue for you and probably for me at this point in our lives, is probably one of the larger ones.
For sure.
I think we've gotten smart enough to try to avoid some of the really destructive physical stresses.
We don't do as dumb.
There's constructive and destructive values, but we try to avoid some of the destructive ones. But emotional stress, think about like, someone gave me this example years ago of like, if you were only talked down to all the time as a kid, what would your posture look like versus if you were only spoken into in a positive way as a kid, what would your posture look like? Yeah. So that is an emotional thing that transfers into a physical representation. Yep. Okay. But it gets even deeper than that. When you're stressed emotionally, your biochemistry changes. Stress hormones go up. All this stuff happens. There's constriction in blood vessels. There are all these things that happen in your body that are happening internally under the surface, and you have no idea. It's like taking a car engine and driving it like very easy and putting 20,000 miles on it or 100,000 miles on it versus taking that same car and it's like you drive. Gas pedal to the floor, hard brake, whatever. I'm just joking. But like 100,000 miles later on one you've replaced, we had a friend recently that had a really nice car and they had to have the whole engine replaced. It was only 5 years old. And I was thinking it was an expensive engine. And I'm thinking, how does that person drive? And B, I don't want to be in a car with them. But
for sure.
But you can take the same vehicle and apply.
Yeah.
And so that's not just all physical in our bodies. That happens emotionally too. Some people are under a lot of emotional stress, and it has a physiological impact.
Right.
And the last one's chemical. And people are like, what do you mean by chemical? We're not just talking about driving behind the truck that diesel fumes are coming through your vents in your car. I experienced that yesterday. We're talking about, do you clean with bleach?
Well, and so, so when I look at chemical stress, my first jump is like, oh, I don't do drugs, so I'm fine.
Yeah.
You know what I'm saying? Like, I'm not somebody who.
But one of the worst ones I know of, I know a friend and a couple of patients who their kids were swimmers. Swimmers,
right. So really, the idea that chemical stress is so many more layers. Chlorine. And so much more nuanced than what we actually than like, oh, you don't do hard drugs on the street. Okay, then you don't have chemical stress. That's literally not true. The average woman puts over 500 personal care products on their body in a given day.
Not 500 personal care products. They put personal care 500 chemicals that are considered toxic. So they probably put 700 chemicals on, 900 chemicals on, but 500 on average are considered toxic to the body, which is wild.
Which is an assault.
So what does that have to do with what we're talking about is it leads to this burden that builds over time. So whether it's physical, you got punched in the neck, whether it's emotional and your posture is distorting, or whether it's chemical and your inability to recover and regulate inflammation and healing, they all lead to this same thing, is that your body has an inability to adapt properly. And then when your body can't adapt, that's not ideal, but what happens is it leads to this chronic stress issue, not because your body's broken, but because you're now interfering with the way your body wants to thrive and function. And communication's key. Those three things, we call them the 3 T's, thoughts, traumas, and toxins. So physical, emotional, and chemical, thoughts, traumas, toxins. The 3 T's, when they get built up, lead to this problem called subluxation. It's kind of like the fuse box in your fuse cabinet. It was not a fuse cabinet. What do they call that? Breaker box, whatever.
You have a much higher
I don't even know what it's called.
Of knowing what a breaker
whatever
box
it's called.
is called. Yeah.
But it's like blowing a fuse. Like it's too much stress. So you blow a fuse. And then as a chiropractor, one of our jobs is go in and look for the fuse, right? So when somebody comes in, they're having chronic pain.
Yeah, they have something like chronic pain. That's why we're always looking at the nervous system. So what's funny is that you have somebody come in and they're like, oh, my elbow hurts, or my shoulder hurts, or I have this like chest pain that I have. And for, we hear it all the time of somebody who isn't educated inside of chiropractic. They're like, what? And you're like, oh, a chiropractor could help that. They're like, what on God's green earth could a chiropractor do for chest pain, for an elbow pain, for knee pain, for something that's happening in my body that's painful? And that is the exact explanation, that fuse box, that stress system, that nervous system controls and coordinates every single thing in your body. And so through regulating that, you regulate how your entire body heals. And what we always are looking at the nervous system when someone comes in, because it's all about regulation. So even though we have things in our office, like we do shockwave therapy, and we have plenty of patients who see so many benefits of it, it doesn't live on an island. And it has to be foundationally paired with regulation of your nervous system.
Yeah, we pivot around chiropractic. What I mean pivot is not pivot away from, but pivot meaning that's the center. We keep one point on chiropractic, and we can pivot towards these other things that have impacts on healing, but we always have to be grounded in this one thing called chiropractic. So I'm reminded of a patient of ours. His name's Roger. I'm not going to use his last name, but his name's Roger. He's in his 80s, and he came in, he had atrial fibrillation, he had blood pressure issues, his inversion fraction was off, meaning the way blood was ejecting from his heart was all jacked up. It's a rhythm issue inside his heart. And his doctor was saying, hey, we need to go in. We need to do an ablation. We need to fry some of your neurological tissue in your heart to the point of creating a callus in your heart and damage nerves, so that we paralyze them enough to where, like, hopefully we get the timing. Like, I don't know. It sounds kind of crazy. It sounds like when my grandfather was deaf and he was trying to tune cars by putting a screwdriver on the engine and watching the vibrations because he couldn't hear. Most people tune cars by hearing, but this is like very like, hey, we're just gonna like go do this stuff that's not ideal. And what's crazy is he came in and we started adjusting him and we started getting the interference out of the way. And we didn't have to know anything. We didn't have to come up with these finagled ideas. What happened was his body started regulating it better and his nervous system started to heal and his blood pressure got better. His heart rate got better. His ejection fraction got better. Now's the time where if Roger's like, hey, I want to get back to pickleball or I want to go lift weights, now we throw in Shockwave.
Yeah.
Because now we can throw in a stimulus that allows for increasing circulation, challenging the tissue. Now that we removed the interference from brain to body and we're correcting those subluxations, now we can get to the point where like, you know, this is the saunas and the cryotherapy or cold plunging or whatever. Now we can stimulate the body.
Red light therapies.
Because adaptation has to come first and we have to be able to adapt. But if you're just jumping in cold water and your body is really terrible at adapting right now, not going to go well. There's these articles out about like how cold water is not good for women because it can mess up their thyroid. No, these ladies are subluxated.
Right.
And their thyroids are already not functioning well. So yes, if you force them into an adaptative situation where they don't have the ability to adapt, it's going to go poorly. If you try to do Shockwave or, you know, whatever on somebody, cold laser therapy or, red light therapy, but their nervous systems aren't regulated. This is why we always put chiropractic first, because it's all about repair and regeneration and adaptation. It requires a rhythm within that nervous system. D.D. Palmer, the original founder of chiropractic, called it tone. And I love that terminology.
Tone. That's huge. That's huge. It always breaks my heart when I hear somebody kind of putting that cart before the horse, right? Mm-hmm. When they're or recommending to a friend or recommending to somebody, you know, God forbid, all the armchair doctors on social media, recommending something to somebody with an unregulated nervous system. Mm-hmm. And you have a friend who's like, oh, you know what? I tried that and it just didn't work.
Mind you, some of those doctors have unregulated nervous systems.
Right.
Like they've never been adjusted. They don't even have that foundation yet. You know, they're like detox specialists. They might sell, I don't know, greens or bone broth or whatever, but or whatever they are out there. But it doesn't matter. Is your doctor first looking at your nervous system? Right. That's the key.
Right. And so this is the part that you have to connect together, that you're not separating the heart from the spine, right? You're not separating your tissue from your brain.
Yeah.
You're not separating symptoms that you're having from the system that regulates them. That is so crucial. And the body doesn't operate in pieces.
You love that line.
Right?
Yep.
It just doesn't operate. It doesn't.
No part of the body operates separate in and of itself.
And we love the line, but are you living it in your real life?
Yeah, I like that.
Because it's not just, you know what I'm saying?
Yep.
Like it's not just a platitude. And if it resonates, if it hits you, then check your Google Calendar for what time your chiropractic appointment is this week.
Yep.
Do you know what I'm saying? Because that's really living through that.
Yeah, we're talking about the heart, but can we bridge the gap into chronic disease? Heart rhythm can be thrown off by stress or whatever. My question is, are you adjusted? Blood sugar can be thrown off by things. You could eat a crappy meal. We all do. But are you getting adjusted? Is your nervous system clear, right?
Right.
What about your immune system? Like, yeah, sure, it's cold outside. You might be under more stress. Like, yes, you might be exposed to more germs, honestly. How's your nervous system functioning? When was your last adjustment? All of it's about regulation. You lifted weights, you did whatever. There's more inflammation happening in your body. How good is your nervous system? That's my question, because it all depends on communication. I had a patient ask me just the other day, Dr. Ryan, I really am thinking about going down to every other week. And I just got off a phone call with a friend, and I would say somebody who is allowed to speak into me from a chiropractor and, you know, helps coach me. And I think we do it to each other. But he said, it's not always about yes. Your patients will sometimes respect you even in the no's. And it was funny. We just had this conversation. She goes, I'm thinking about going down to, every other week. And I looked at her and I said, you can do whatever you want, but do you want to hear what I think about that? And she goes, absolutely. And I said, not a chance in where. She goes, what? And I go, I want blah, 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 blah for you. I want regulation. I want you healing. I want this. I want this. And then I showed her x-ray and I said, that spine has been through a lot, and it's been through a lot for 20 years. You've been under care for about 8 months. If you knew what I knew, you'd want to stay in rhythm and keep it regulated. And she goes, okay,
right,
that's what I'll do.
Right.
But she just needed to hear that rhythm and that function of your nervous system, and staying connected is more important than I could take this $30 or $40 and go join a gym or do this thing or whatever. Like, I get it. I get that we're time and finances, whatever, but the most valuable thing you can do is stay connected to the source of your healing and function. That's what I love.
I love that so much. And really not asking the question, what's wrong with my heart, but really asking the question, is my nervous system regulating my heart right now? And so a lot of times when I have that immediate thought of like, oh, something's wrong, or, oh, is something wrong with me? Or, you know, it used to be when we were younger, I was always like, well, I'm in my 20s, nothing can be wrong with me. Or I'm in my 30s, I'm too young for anything to actually be wrong with me, right? And then, you know, now that I'm walking in to entering into 40s, I'm like, oh, maybe I'm getting to the age where stuff could potentially be going wrong right now. And one of the things that I always anchor to is that I know that my body's always conspiring on my behalf. I know that. But I also know that my nervous system is regulated. Right. And so I know when I feel those glimmers of some sort of anxiety or question or wondering, like, what the heck's going on in there? Because I can't see inside. I can only see outside. That I know that my nervous system is regulated. And I know that it's taking care of what it needs to take care of.
That's huge. I love it. Your heart doesn't work in isolation. That's, you know, or any body part for that matter. I want you guys to know that everything responds to signals. So whether it's your heart, whether it's your gallbladder that you may or may not still have, whether it's your appendix. For me, it was my tonsils. This is a real life story. Like, for me, it was my tonsils and my ear infections, but it wasn't my tonsils. God didn't give me bad tonsils. God didn't give me bad ears. I had interference in the pathway from my cranial nerves, from my brain to my ears and to my tonsils. And subluxation was creating interference. And when that interference was removed, my ears healed. And unfortunately, my tonsils were already gone at that point. And so that's the challenge I want to give you guys is, you know, there's a pill for every ill. Don't get me wrong. There's a potion for every emotion. There's an elixir for, I don't have a rhyme for that one. But, you know there's one for something.
I was trying to figure
out what I was going to do. But the reality is, it's not outside in, it's inside out. And there are times for surgery. There are times where drugs do some things, but largely, that's not it. Largely, we end up into that position because we've ignored adaptation. We've ignored the source. We've ignored the communication, sometimes by choice, but more often than not by ignorance. And so what I would challenge you guys to do is, if you've never been adjusted, you've never seen an x-ray of your spine, you don't know how your nervous system is functioning, get that done first. And then number two, if you have, share it with somebody. Share this episode with somebody who hasn't, because that could change their life. I promise you, the answer for them isn't the 7th drug. The answer for them isn't the 4th surgery. What if the answer is the thing they've never done, and it's the communication from their brain to their heart, their lungs, their body, whatever that is. And sometimes even the worst scenarios are not that far away from change. It's just that we've been going so far in the wrong direction. So thank you guys for joining us. Until next time, this is the Align Your Health Podcast.